Christian Espinosa, founder and CEO of Blue Goat Cyber. Welcome to the podcast.
Thanks for having me on, Kayleen. Appreciate it.
So, Christian, I love sitting down with a fellow podcast host. You're the host of the Med Device Cyber podcast, and I'll drop a link in the show notes so that our audience can get connected with your podcast, and it's a really terrific one. I've also heard you speak several times at the DeviceTalks conferences and other conferences, and you're a really terrific speaker. I'd be really surprised, Christian, if our audience is not already aware of Blue Goat Cyber, but just in case they aren't, would you mind telling us a little bit more about Blue Goat Cyber?
Sure. Blue Goat Cyber focuses on medical device cybersecurity. So we help medical device manufacturers with all the pre-market documentation, all the testing, all the analysis, all the risk assessment in order to get their device cleared by the FDA of the United States. We do EU MDR and other regulatory authorities around the world, but we do all the pre-market guidance and all the work for pre-market submission, and then we also do post-market management. So we help a manufacturer get the device cleared, and once it's cleared, we have an annual contract where we monitor the device for new threats and new vulnerabilities and attack profiles that may change as well.
Excellent. If you could help us unpack or maybe walk through the process of how you work with medical device companies, I think that'd be really helpful.
There's three main ways we work with a medical device manufacturer, and this is really where they are in their development cycle or funding cycle to typically tie together. The first is we have a secure medtech design consulting service. This is where a manufacturer, if they're in Series A funding typically, and they're developing the product or trying to iron out the requirements, we will help them design cybersecurity into the device. Because all the regulatory authorities require what's called a secure product development framework. They want security designed into the device, not bolted on at the end. So we help them with those design decisions because we realize most software developers are worried about functionality, and we help infuse that cybersecurity lens into the development process. That's the first part. Later on, typically 6 months is kind of the sweet spot before a submission for, let's say, a 510K in the United States with the FDA. We work with the manufacturer to do all the documentation, all the testing, and all the analysis so we can work with whoever's submitting their package and provide them everything required for the cybersecurity requirements by the FDA. And once the device is cleared, and we guarantee our clearance as well, we work with the manufacturer and guarantee our work. So if there's any additional information request or a deficiency letter, we've never received one of those, we will make sure we address that. And then once the device is on the market or is cleared, we then do post-market management. That's an annual contract where we look for new vulnerabilities. We set up a vulnerability disclosure portal where somebody can log a vulnerability if they discover it. We do triage. If there is a vulnerability reported, we run it to ground to make sure it's a true positive versus a false positive. And we work with the manufacturer to help update the device and keep it secure. So basically, we look at the full product lifecycle from the inception until disposal, and we can work in any of those areas.
So it sounds like to me, Christian, that companies in the medical device industry should work with you as soon as possible, like at the very beginning of the medical device product development cycle. So with that in mind, what type of companies do you work with? I mean, is there a specific range or company size?
We have a portfolio, I would say, of 60 to 70% of startups. So this is a physician or someone that came up with an idea and they're trying to bring it to market. That's about 60 to 70% of our portfolio. And they're going through rounds of funding. So we typically work with them in Series A or Series B funding. And then the other 30% or so of our portfolio are large companies that have a suite of products. These are often publicly traded companies that have a line of products, like in the vitro diagnostic space, for instance, and we work with them on all of their products for the pre-market as well as the post-market.
Excellent. So now I better understand the types of companies you work with. Let's shift to the future and what's to come. Are there any new products that you're able to discuss with us coming out of Blue Goat Cyber?
We are a service provider, but we do have a product that we are testing still in order to enhance our service offering. And that product, right now, we're calling it a collaboration portal. But what it does, it allows us to collaborate with our clients on the documentation creation. They can make comments, they can upload documents, they can see visibility into where we are with each document that's required for the submission. And one of the things that people have asked us about before is where we are with each document from a percentage completion wise. So this dashboard that's part of the collab portal has percentages per document and percentage overall for the entire project. So it gives complete transparency and visibility for a client to know exactly where we are in the process.
Well, that's very encouraging. Thanks for the little teaser. And I can't wait to hear about it when it does officially come out. So make sure that DeviceTalks knows first. Let's talk about the future. So obviously, cybersecurity has always been top of mind for medtech companies. Artificial intelligence coming in, using large language models, data, this is all, I think, your area of expertise. So how do you see cybersecurity changing in the future? First, near term, and then we can take it a little longer.
I think it is just now starting to become not quite top of mind, coming to people's minds, unfortunately. I think in like pharma, cybersecurity has been a big concern for a while, but then in medtech, like as an example, the FDA just finalized their cybersecurity guidance in June of 2025. So it's
Didn't realize that.
yeah, it's been in draft since 2023. But we've had a couple cases come up that have really illuminated some of the concerns about cybersecurity. One is the Illumina case, where they sort of swept a few cybersecurity like vulnerabilities under the rug and got it approved, and then a whistleblower exposed that. So they were fined. I forgot the amount. I think it was like $6 million by the Department of Justice. That's kind of raised a lot of eyebrows about this. Some of our clients have come to us and said, hey, we want to make sure we don't get in trouble. We want to do everything 100% perfectly. We're like, great. That's how we want to do it as well. And then as far as AI and the trends with AI, I kind of think we're too premature to really roll out AI. There's a case that's going on right now where there's a wellness application that is doing therapy for a patient. This patient was suicidal, and the wellness app that used AI, after a couple months, told the patient, well, you might as well go ahead and kill yourself. And the patient did kill themselves. So
Wow.
we rarely look at what happens when AI gets it wrong, but the consequences can be dire, as in that case. So I think, there's a cybersecurity component to AI, but there's also just the maturity of AI in this industry. And I think we need to consider that take it very seriously.
Absolutely. And very, very well said. Is there anything else that you would like to add or like our audience to know?
I think we just have to be very leery about a lot of advancements, like even autonomous surgical robots, because when we remove a physician from the equation and something does go wrong, the risk is much higher. So cybersecurity is starting to become a little more important. People are finally starting to understand the implications, and they are very real with medtech cybersecurity, because we're not talking about data disclosure. We're talking about harm to a patient. So I think the risks are much greater in this industry.
Very well said. And thank you for bringing that awareness to our audience. And with that, Christian Espinosa, founder and CEO of Blue Goat Cyber, thank you so much for joining us on the podcast. And for our audience, if you want to learn how you can work with Blue Goat Cyber, please visit their website at bluegoatcyber.com. That's BLUEGOATCYBER.com.